This is Dr. Alf Garbutt of the La Crescenta area in Los Angeles, California. This is another one of the videos for the ACA Rehab Council's journal. I'm going to share another clinical pearl dealing with the Quadratus Lumborum. I find it's an overlooked muscle by a lot of doctors, and if you want to test it, then look at one of the Kendall and Kendall books, or Dr. Walther's Applied Kinesiology book. They'll have information on how to do manual muscle testing on them. Now, this muscle basically is going to attach around the posterior aspect of the ilium. It's going to come medial and superior, attaching along the transverse processes of lumbar 1 through 4. The inferior attachment also will tie into iliolumbar ligament. And if that's hypertonic on that side, it can aggravate that ligament, and that can be a source of some low back pain. These muscles also attaches to the lower aspect of the 12th rib and assists the diaphragm in stabilizing the area and respiration. It's very important as a major stabilizer to the low back. It's going to be below the erector spinae group. You can't palpate straight through, but Dr. Raymond Nimmo, the developer of the Nimmo technique, or the receptor tonus technique, came up with a way with a prone patient coming on the sides and going inferior to the erector spinae. You can come in and you can get some palpation on it and check for palpatory pain. Be careful not to just jab in it, because if you hit the transverse process, you can really cause some pain or cause some injury. So go easy in it, but you can palpate it to see if there is, and sometimes you'll feel hypertonicity. Other times you get palpatory pain is one of your findings. Part of what it's going to do, if you have a level pelvis, it's going to help with keeping the lumbar spine straight. If on an x-ray you see your palpation on a standing person, you have a level pelvis, but you have a lateral inclination, then most likely you're going to have a hypertonic muscle on the side that's inclining toward, and a hypotonic or weaker muscle on the other side. Most of the time, not always, but most of the time the key problem is the weak muscle. So you want to strengthen it and stretch and loosen this one. And we have a couple ways to look at this. If we have somebody who has had some disc injury, we want to be careful on how we're stretching and doing things, and even strengthening it. And so I'm a little cautious in the area, but some of the things I'm going to show you should be workable in either case. We don't want to use it with an acute lumbar disc, but if it's the case that later on needs some help, strengthening after its disc is calmed down, then some of these things can be used. But you get somebody coming in a left lateral antalgia, it may be a disc. Most of the time I think disc, but again, if it does, the indicators don't show disc, look for Quadratus Lumborum and possibly psoas involvement, because those two will work together also. So I think that'll cover the key aspects on that. If the lumbar spine is stabilized, it can be used to hike the hip up. So if this is my weak side, I can have a person standing on something that's going to be stable for them. My foot is below the platform, so that's stretching it right now. So I can get a range of motion here. So I'm lifting, I'm hiking it up, and I'm trying to keep the lumbar spine straight. So that way it's lifting that inferior attachment up and holding it. Hold it for 4 to 5, 6 seconds, slowly down. Let it stretch all the way. So you can do repetitions of this. Don't do high reps at first. It'll tend to cramp if the muscle's inhibited or deconditioned. I like to start somebody off with maybe 5 and then eventually build up to that. So that's where we're using body weight. You can then also take an ankle weight and put it around the ankle and hiking it up. Again, make sure they're level here, because sometimes when there's a problem in the anterior rotate, so when you get somebody with an anterior rotated pelvis, consider this also. So again, with a weight, ankle weight, hiking it up and stretching it down. Now that can also be used on a hypertonic muscle. Say this side is hypertonic, I can just have a person at home stand on a step and let the foot hang below the other platform. And again, that's stretching it, as long as they're not leaning here. Stabilizing here, letting it stretch. A weight could also be used if needed, and letting it stretch out. And they can do that a couple of times a day to stretch that hyper side. Heat can also be applied to the hyper side. Cold can be used to the hypo side if you need to. Stretching down there. We can use a kettlebell. If I'm trying to strengthen my left quadratus lumborum, I'm going to stand, and then I'm going to hold the kettlebell in the opposite side, because otherwise it's trying to pull me down. It's trying to pull me this way. So I'm using the quadratus lumborum on the other side to keep that lumbar spine relatively vertical here. So that also can help with stabilizing and strengthening it. There's other ways, but these are just some simple ways that you can do in the office or have a patient do at home. Again, start off easy with this, because that muscle, when it's weak, can cramp up on a person, but gradually doing that. Then you could use other combinations to coordinate it. A lot of the things we're doing, especially from the European schools, we're trying to do a lot of coordination activities, but I find there may be an individual muscle that's so weak or inhibited that it doesn't quite activate, and the other larger muscles compensate, and there's always a relative imbalance. So this we can isolate. I believe, I know people argue with me, but I believe take that extremely weak one and work it up a bit, and then start doing global exercises that synchronize and coordinate everything together. So if you have questions on this, most of you have my email address. You can let me know, or if you see me at the annual Rehab Symposium, you can talk to me. And I like this a lot for working the Quadratus Lumborum. Thank you.